Hello everyone. Today our topic is clavicle, which is the one of the bone of the upper limb. We have 206 bones. The upper limb contains 64 bones out of 206 bones. Each side consists of 32 bones. The distribution of which as shown in the table 1.2, where we have sternum, clavicle, scapula, humerus, elbow bones, forearm bones, wrist bones. Like this, we have wrist bones, we have metacarpals, carpals, phalanges, like that. Now we are going to study about clavicle. The clavicle, in Latin called a small key, is a long bone. It supports the shoulder so that the arm can swing clearly away from the trunk. It supports the shoulder. The arm can swing away from the body with the help of clavicle, which is a horizontal bone in the human body. It transmits the weight of the upper limb to the sternum. The bone has a cylindrical part called the shaft, two ends, and lateral and medial. The bone is divided into three parts, that is shaft is edge shaped, and the lateral end and medial end. We have three parts in it. Now we are going to study about peculiarities of the clavicle. It is the only long bone that lies horizontally, means which lies horizontally in the body, that is like this, horizontally in the body. It is subcutaneous throughout. Subcutaneous means below the skin, means under the skin, subcutaneous. It is also called as beauty bone or collar bone. It is the first bone to start ossifying. It is the only long bone which ossifies in the membrane, and it is the only long bone which has two primary centers of ossification. It has two primary centers of ossification, that is, I will show you here. We have two centers of ossification, that is in the middle of the shaft, that is two primary centers, and one secondary center at the sternal end, that is lateral end. Okay. Next, it has no medullary cavity. It is occasionally pierced by the middle supraclavicular nerve. It receives weight of upper limb via lateral 1/3 through corococlavicular ligament and transmits weight of upper limb to the axial skeleton via medial 2/3 part. That is here. It transmits the weight of upper limb through lateral end through the help of corococlavicular ligament in the lateral end, and with the help of shaft to the medial end, that is transmits to the weight of upper limb to the sternum of the human body. Sternum is located in the middle part of the, means medial plane of the human body. Features. Shaft. The shaft is divisible into lateral 1/3 and medial 2/3. The shaft is divided into lateral 1/3 and medial 2/3. Lateral 1/3 and medial 2/3. This is called lateral 1/3 and this is called lateral medial 2/3. Now we will go and study the features of the clavicle. Clavicle is divided into three parts, that is shaft, lateral and medial ends. Now shaft we are going to study. The shaft is divisible into lateral 1/3 and the medial 2/3 we have discussed. The lateral 1/3 of the shaft is flattened from above and downwards. It has two borders, anterior and posterior. The anterior border is concave forwards. The lateral 1/3 of the shaft is flattened from above. The lateral 1/3 is flattened from above, that is this one, and the above downwards it has two borders, anterior border, posterior border, medial border and lateral border. The anterior border is concave forwards. The anterior border is concave forwards. The posterior border is convex backwards. The anterior border is concave forwards and the posterior border is convex backwards. From this it is backwards, that is convex backwards. This part of the bone has two surfaces, superior and inferior. It has two surfaces, that is superior and inferior surfaces. Here we see about the superior surface and here we see about the inferior surface. The superior surface is subcutaneous and inferior surface represents an elevation called the conoid and tubercle and ridge called the trapezoid ridge. Here superior surface is subcutaneous under the skin and inferior surface, that is it has conoid. This is inferior surface, inferior aspect. We have conoid, tubercle and trapezius. This is trapezoid ridge and this is conoid ridge. Conoid, tubercle. Tubercle means which is bumpy in shape, that is called tubercle, and trapezoid ridge is the ridge for the trapezius muscle, attachment of the trapezius muscle. We will study in the attachments that later. Next, the medial 2/3. We have studied about lateral 1/3 of the shaft and medial 2/3. Now we are going to study. The is rounded and is said to have four surfaces. It has four surfaces, that is which is quadrilateral in shape. So it has four surfaces, that is the posterior surface, the inferior surface, anterior surface and superior surface. Okay, now the inferior surface has a rough oval impression at the medial end. The lateral half of the surface has longitudinal subclavian groove. The nutrient foramen lies at the lateral end of the groove. The medial 2/3 of the shaft is rounded and said to have four surfaces. The anterior surface is convex forwards. The anterior surface is convex forwards. The posterior surface is smooth. posterior surface means this surface is smooth and the superior surface is rough in its median. The superior surface is rough in its median. The inferior surface has rough oval impression at the medial end, rough oval impression at the medial end for the costoclavicular ligament, and the lateral half of the surface has longitudinal subclavian groove. This is the subclavian groove, which is located in the lateral half of the surface of the longitudinal subclavian groove. The nutrient foramen lies at the lateral end of the groove. Here will be the nutrient foramen. Nutrient foramen which gives to the nutrition to the bone, that is called nutrient foramen, which lies in the longitudinal. Here lies the nutrient foramen. Okay, now we have studied the lateral and medial ends. We have studied the lateral 1/3 of the shaft and the medial 2/3 of the shaft. Now we are going to the lateral and medial ends of the clavicle. The lateral and medial ends. The lateral or acromial end is flattened from above downwards. We have studied it bears a facet that articulates with the acromial process of the scapula to form the acromioclavicular joint. Here we have lateral end, which is also known as acromial end, where the scapula is attached to the clavicle for the articulation of the acromioclavicular ligament or joint. The medial or sternal end is quadrangular and articulates with the clavicular notch of the manubrium sterni to form the sternoclavicular joint. Here sternal end, which attached to the manubrium sterni of the sternum, which gives the sternoclavicular joint. Here sternoclavicular joint for the articulation of the sternum and clavicle. Here clearly you can understand where the sternoclavicular ligament attachment. The clavicle is attaching to the sternum here. The articulation surface extends to the inferior aspect for the articulation of the first costal cartilage. This clavicle is attached to the first costal cartilage of the ribs. Now we will go into the attachments of the clavicle. We have studied the features of the clavicle. Attachments is the most important role in the anatomy. We have to understand them. At the lateral end, the margin of the articular surface for its acromioclavicular joint gives attachment to the joint capsule. At the medial end, the margin of the articular surface for the sternum gives attachment to the fibrous capsule of sternoclavicular joint at all around. Articular disc posteriorly, interclavicular ligament superiorly. Lateral 1/3 of shaft, the anterior border gives origin to the deltoid. Here deltoid muscle will be there, which is also known as the injection muscle of the human body. Deltoid The posterior border provides insertion to the trapezius. This is called the posterior border. We have trapezius muscle, which helps in the elevation of the body, elevation of the shoulders, not body, that is trapezius muscle. We have the origins and insertions of the trapezius and deltoid. The conoid tubercle and the trapezoid ridge gives to the attachment to the conoid and trapezoid parts of the coracocavicular ligament. We have here the conoid tubercle and trapezoid ridge for the conoid and trapezoid parts of the coracocavicular ligament. Next, medial 2/3 of the shaft. We have studied about the lateral 1/3 of the shaft, and now attachments of the medial 2/3 of the shaft. Pectoralis major, which is the major chest muscle in the human body, which is originated from the clavicle. A muscle can have more origins and insertions. Now we study about pectoralis major, which is originated in the clavicle, that is in the middle 2/3 of the shaft. Pectoralis major, which is present in the superior and inferior aspect. Half of the rough surface gives origin to the clavicle head of the sternocleidomastoid. Sternocleidomastoid is the muscle or joint which helps in the side by side movement of the human body, that is neck movements. Sternocleidomastoid from the neck to the clavicle, that is located here. Sternocleidomastoid, which is important. Remember sternocleidomastoid. The early impression on the inferior surface at the medial and gives attachment to the costoclavicular ligament. Ligaments, it is indicated by green color in the diagram, that is ligament, costoclavicular ligament. Now the subclavian groove gives insertion to the subclavius muscle. This subclavian groove is there here in the bone representation, and here muscle representations, attachments. Subclavian groove is giving to the subclavius muscle for the insertion. It is insertion. Blue color represents insertion in the diagram. Red color represents origin from the diagram. The margins of the groove gives attachment to the clavipectoralis fascia. Fascia means the skin present below the skin is called fascia. The skin which attaches to the skin and the bone is called fascia. Okay. The posterior surface close to medial and gives origin to sternohyoid muscle. Posterior surface close to medial and gives to the sternohyoid muscle. Here sternohyoid muscle is originated in the medial end of the shaft. We have completed lateral and medial thirds of the clavicle. Now the subclavian muscles of the brachial plexus pass towards the axilla, lying between the inferior surface of the clavicle and upper surface of the first rib. Subclavius muscle acts as a cushion. The nutrient foramen transmits a branch of the suprascapular artery. Ossification. The clavicle is the first bone in the body to ossify. Ossification means formation of the bone in the human body is called ossification. Except for its medial end, it ossifies in membrane. It ossifies from two primary centers and one secondary center, as I told you in the peculiarities of the clavicle, which have two primary centers and one secondary center. The two primary centers appear in the shaft between the 5th and 6th weeks of intrauterine life and fuse about the 45th day. The secondary center for the medial and appears during 15th to 17 years and fuses with the shaft during 21 to 22 years. I didn't had fusion of clavicle in my body. How many members didn't have fusion of their clavicle in the body? Please comment in the comment box. Occasionally there are many may be a secondary center for the acromial end. Occasionally. Clinical anatomy. Here comes the game changer of the clavicle, where it is very important in the examination view and the knowledge aspect. Clavicle is commonly fractured by falling on the outstretched hand, means indirect violence, means unexpected fall from the height or due to some obstructions like hurdles, like through them when you fall from outstretched hand, it may be broken in the mid shaft. The most common site of fracture is the junction between the two curves, that is a shaped curve. It is the main junction for the fracture because which is curved in shape and it is the delicate part of the clavicle, so it may be fractured. The lateral fragment is displaced downwards by the weight of the upper limb, and trapezius muscle alone is unable to support the weight of the upper limb. Here the broken part is shown. This is a deltoid muscle and this is the trapezius muscle. The trapezius muscle alone cannot bear the weight of the upper limb, so that it moves downwards, and the medial 2/3 will go upwards by the other muscle, and the trapezius muscle will move to the downwards due to gravitational pull, so that the trapezius muscle is unable to support the weight of the upper limb. The clavicle may be congenitally absent or imperfectly developed in the disease called cleidocranial dysostosis. I have posted in the group clinical anatomy of the in the description. I have sent in the YouTube, that is cleidocranial dysostosis. In this condition, the shoulder droop and can be approximately anteriorly in front of the chest. This is the condition where the absence of the clavicle appears in the X-rays. This is called the cleidocranial dysostosis, abnormal growth of the clavicle. Here ends the clavicle topic. If you have any doubts, you can clarify in the comment box or just message me up. Thank you all. Jai Hind.